Hello, friends. A very good day to all of you out there, and a very, very warm welcome from the entire team of RFA. Here is your mentor this side. Thank you so much for joining in. Is my voice audible and clear to all of you out there? Hello, can you all hear me loud and clear, please? How's everybody doing out there? Hi, Rehab. Hi, Nagmani. Hello.
Hi,
How's everybody doing? Hello, Safa. How are you, my dear? Hi, Savarna. How's everyone? Thank you very much, back in team. Thank you, Samsung. Samsung, can we request all the iPhones and iPads and Samsungs to write their names? That will be easy for us to communicate with you guys. And let's start
German.
with introduction. Thank you very much, Alicia.
Marhaba.
Deb.
Be on the mute mode. Thank you so much. Thank you. A warm welcome to all of you from the entire team. We are grateful for having faith in our theaters. Today, we are taking the first step towards the entrance exam, that is MRCOG Part 1, January 2027. You have been watching the champions for the last 3-4 minutes, and you were seeing that how much high scores they have been scoring with RFA tutors. We expect the same with you guys. We are here to support, we are here to help, we are here to guide. With this focus start, I want one oath that ups and downs would be there. We will be having some challenges with families, with the work, with home, with health, with commitments. But we will do it with smile. We will do it with confidence because today we are starting this new journey with this aim that we want to change our life. We want to add on one more degree to our career. We want to be stronger and better than others, and this is what life is all about. We never say that things are easier, but we definitely say that things are doable. This is our motto. And you will see the mentors, you will see your team working so hard with you that you would realize that, okay, if they're giving their 100%, let us give our 200% because you'll find 24/7 support here. I'm here to guide, I'm here to lead. Thank you so much for joining in, the ones who are listening to the session introduction today. I would like all of you to know that out of all the parts, MRCOG 1, MRCOG 2, and MRCOG 3, definitely, yes, part 1 is the easiest. Nevertheless, it's an exam. So definitely we need to work hard together and we will do that for sure. Thank you so much. Hi, Alicia. Yes, thank you so much. Volume, you have to increase iPhone from your iPhone because from our side, I think my voice is clear. Can I have a thumbs up that the voice is okay? Yeah. Thank you. So they say to be successful, definitely first step has to be taken, and that's what we are doing today. We are taking the first step, and that is towards the success. Thank you so much. So what are we going to do today? We will tell you that why to take MRCOG 1 and how to prepare for MRCOG 1. What are the prerequisites before the preparation? And this is a very high passing rate exam, but still, if somebody fails, why they can't make it in one go, and what would be our technique and strategy to make you successful in one go, right? When we talk about why to take MRCOG, definitely yes, when you have obstetrics and gynecology degrees all over the world, it's one of the prestigious college, definitely high credibility is there. You get lots of pathways and horizons, leadership in medical education. Your competency definitely improves. Your work standard definitely gets better. Moreover, it's a globally recognized qualification. You want to work in UK, you want to work in Ireland. This is the first step. If you do MRCOG 1, you get an opportunity to do directly the Irish exam MRCPI Part 2. You don't have to take the Part 1. Moreover, this is one degree that's going to open your horizons towards the Gulf, towards the Europe, towards many countries where you want to practice, you want to have your job, you want to shift. So this is one part, one step that would open up lots of opportunities for all of you. The prerequisites for Part 1 exam. Here we have the chief coordinator, the chief mentor, the lead. Hi, Safa, how are you?
Hello, ma'am. Hello, my dear mentees.
Thank you so much for joining in, my dear. I know this is clinic timings for lots of mentors for Part 1, but thank you very much, Preeti. Thank you very much, Orva. Thank you very much, Kusuma, for joining in. I'm proud of you guys for all the efforts. What are the prerequisites for Part 1 examination? What do they need to get
Yeah.
ready for?
Yes, ma'am. So this is the first part in the MRCOG journey. So first and foremost, you all should do the website, login with a membership. So you have to make an account. Once you make an account, you will be provided a number. This will be the membership number throughout your journey. Okay. Then after that, you have to fill up the eligibility criteria. So this eligibility criteria, it requires only the primary degree. That is your medicine, MBBS. Okay. Now it is not a separate form. You have to fill up in the website itself. You have to fill up the form and you have to upload the documents which is required, like your primary degree certificate and the registration certificate. And then now nowadays they are asking for the ID as well, passport ID, whichever you are producing. Just make sure that the name in the ID and the name you are registering in the registration certificate, everything should be similar. Otherwise, during the exam, you may face the problems. That's why previously they don't ask passwords and passport and all. Now they are asking about this ID upload as well. Okay. So make a documents ready and do the eligibility application. I think that the last date for eligibility is around September. So before that, you all need to do this eligibility application.
Okay,
And
I would
it
like
will take almost 4 to 6 weeks for the application, no approval. You can wait. And third thing is that you have to do the expression of interest. Though you are though you have already submitted your eligibility long back or last time, but you didn't appear for the exam, you need not to apply for the eligibility again. But expression of interest is very important. It should be done for every exam.
Thank you. So it is for part one, part two, part three. You should be knowing that, yes, even for part two, you will do the expression of interest. I would like to reinforce again one thing very important here. Many girls before marriage, after marriage, the names are changed. Sometimes the names are changed for any reason. But RCOG name is one name which you need for the Pearson centers. Please remember, unfortunately, for part one in the recent exam, few students couldn't appear because of the mismatch of the second name with the documents. Part two, every time on the exam day, they're not able to take exam. So please make sure that whatever ID you're giving, that is the RCOG name, matches to your identification document. Otherwise, we are also helpless at that time. Continue, Safa. Yes, please.
Yes, ma'am. Next pages, ma'am. This is how you have to create the account in the RCOG website. Okay. And the third part is you have to do the expression of interest.
Okay, so
Okay.
all of you, please, you know that how to do the expression of interest because we get so many questions from there. Atik, Alicia, everyone, please. Who's there? Rehab and Nakamani, everybody. You guys know that how to do the expression of interest, everyone? Any confusion in that? Because these prerequisites you have to understand today so that tomorrow we don't miss these dates and we are focusing on the study part. Yes, you all are clear about this? Okay, great. So
Yeah.
with regard
So,
to
and the last one is that booking. So booking will be in the month of October. So on the day of booking, you will get a mail from the college for the booking. Okay, through that link, you can book the center which is near to your city.
Safa, please do tell them about all those things which have been happening for the Pearson centers now in the introduction, because in the end they find so much of a difficulty regarding the center changes, or sometimes the seats are not available. You have to travel to the others. So that is
Yeah.
possible. Safa would guide you about that. Please go ahead, my dear.
Yeah. See, this Pearson View test centers actually, if you book as early as possible, you will get the center near to your city. Okay. But it is very unexpected. Sometimes this Pearson centers, even in the last minute, also, cancelled. Even last exam too, in the morning when they went to the center, they told that the center is closed. Okay, so we can't be, it is not guaranteed at all, but you can choose the center which is near to your city. Okay, so that traveling this and all, you can avoid. And very important thing, you have to do the booking as early as possible, because I have seen many students, they'll be waiting for 10 days or 15 days after that, ma'am, exam, this date is not closed, application date is not closed. It is not like that. This is like a first come first service. So those who are booking, they will get the seats near to the city. Otherwise, you need to travel, you have to take a sometimes flight as well. So it is always advisable to do booking, and always we mentors are always there to guide you that what time you have to book, how to book, everything we will be guiding you.
So, all these important dates, you will get the reminder by the team that this is the last date of expression of interest. Please don't miss that out. The last date of the eligibility criteria, don't miss that out, like just Safa was saying about September. We will keep on reminding in the study group, in the open group. I don't want you guys to miss this out once you're aiming for Jan 27. Moreover, the most important thing is that if, for example, the booking date is 12, that doesn't mean that you keep on waiting for the last date. Reason being that you've got Pearson centers and college cannot do anything. College has connected to the Pearson Center with this collaboration. They are conducting this exam. Please make it very, very clear that it is about the seats getting finished. For example, if all the Pearson Center near to your home is booked, then definitely you need to have the distant one, to an extent that 3 to 4 days before exam, even the whole country can get booked and you have to move to the other country. And this has happened with many students. So earlier the better, if you want the right choice, right? Students had been taking flights, students had been traveling by road for 6 7 hours. I definitely want you guys to be at your places, so please do that in time. Pearson centers are in all parts. Second thing before exam, which I always tell, which I would definitely suggest now, that please 3 to 4 days before, if it's nearby, do visit the Pearson Center to avoid the last minute surprises, honestly, because on the day of exam, students reach to the Pearson Center and the center is closed. Some emails come overnight because this can happen. That is a third party. Remember that this is not college. This is a third party who is conducting exam. I hope you guys are understanding. Students, they prepare and they're not able to take exam because of the technical issues in the Pearson Center. We cannot help. College cannot help. Right? So you have to stay connected to your Pearson Center once you book that. I hope I'm making sense and I hope you guys are understanding, because it hurts a lot that studying for 6 months and eventually not being able to take exam. All right. So please be careful on that. Yes, please, Safa.
Yes. So the next page.
Yeah. So you have contact numbers, please, and email addresses. So please stay connected to the Pearson Center and the college as well, please. Yeah. Eligibility.
So the eligibility we have already described. You
Yeah.
have to make sure the documents are ready. That is your primary degree and the passport. Mainly, they will be accepting passport. If passport is not available, you can use your driving
Yeah.
license. But nationalized cards are not acceptable.
Yeah. Okay. So please note it down. If anybody has any query, we are right here to guide. If you have some individual situation, please stay connected so that you can get guided about whatever is the situation regarding that. So processing time has already been informed that it's around 4 weeks. So you just have to wait and you'll get the confirmation by that. All right. So we are preparing for the next exam. The 30th June's been done. We know that we are preparing for January now. Like this, you will get one date. Expression of interest would be there. So we are aiming for January 2027. Yes, Safa.
So the exam is on January 19th. So the date is announced just today. Okay. So these are the dates for the eligibility, the last date, and also the for the expression of interest, booking dates. It's everything available in the website. Okay. You can, after making your account, you can check this often.
Okay, so let's reinforce that Friday, 18th of September, ladies and gentlemen, part one eligibility deadline is there. Expression of interest, please do it prior to Friday, 2nd October 2026. The booking window application opens Tuesday, 27th, and all RFA students will book on Tuesday, 27th. And you're going to give us this confirmation that you're booked. Nobody is going to wait later than 27th so that you get your choices, as we have mentioned. It does close in December, but we are not going to wait till December. All right, okay. And then we are going to be having the successful champion meet on Wednesday, 17th February 2027 with the blessings with all this hard work. The fee structure is different according to the band. Yes, please, Safa.
Yeah, this band will be depending upon the center. It is not like where you are residing. It depends
Yeah.
upon which center you are choosing.
Is this clear? Sarika, Faizun, is this clear, Rehab? Yes, it's not that you're residing in that county where you have booked the exam, you're going to get the application fees according to that. So please see your bands, and it does vary. You can see on the screen that it
Yeah.
varies different parts. Now we have MRCOT1 different modules. So up till now, we have discussed how are the prerequisites, what are the preparation we have to do to be eligible to appear in MRCOT1. Now we need to see what is the curriculum like. We've got anatomy, we've got physiology, we've got biochemistry, we've got endocrinology, biostatistics, genetics, pharmacology, microbiology, immunology, biophysics, pathology, clinical management, and data interpretation. When we talk about these modules, there's a set pattern and the difference in terms of approach. And we have got very, very highly skilled mentors there who would actually prepare you for all these modules one by one, topic by topic, with a perfect daily schedule, reinforcement with this. Let's see the distribution of
Yeah.
questions.
Yes, ma'am. Ma'am, before that, Dr. Alisha having question about the bands.
Yes,
Regarding the bands, it is in the website. Okay, A, B, C. The what are the countries coming under that? It is available in the RCOG website. Okay, dear, you can check. Most of the South Asian countries like India, Pakistan, and all, it will be coming under B, whereas Singapore, UK, it will come under A.
all right. Alicia, if you have specific question, please, this is my number. This is website team number, or you can message directly us if you have any specific like traveling or any question which you need clarification on. Okay. Right. Yes, please. So we have difference in the percentages. So that why this is important because we need you to put attention and focus according to that, that how much is the study or how much is the component coming from each. Anatomy generally contains 25%, and Preeti is here. Preeti, are you there? Physiology 17%, endocrinology 21%, biostatistics 13%, which is definitely more than part two.
No, ma'am.
Embryology 8%. Hi, Preeti, how are you doing today?
I'm good, ma'am.
Thank you. Biochemistry 8%, genetics 8%, data interpretation 22%, pathology 18%, pharmacology 18%, microbiology 15%, clinical management again 11%, biophysics 9, and immunology 7%. Let me tell you guys that we are making the curriculum, we are making the plan of the sessions according to this so that you guys exactly have the idea about how much effort is needed. And paper one, paper two, generally they're distributed this way, but it can be different as well. Safa, would you like to add something in the distribution, my dear?
Yeah. So you have 100 questions in the paper one and 100 questions in the paper two. So in paper one, it's a basic science like anatomy, physiology, and biochemistry, adding with that embryology, genetics, and endocrinology. Okay. So among this, all the questions answers they will be divided into mild, hard, easy, moderate, and hard. Okay. So the questions, it's not equal marks for all of them. Some question, easy questions, it is less than one, whereas difficult question, it is more than one. So most of the time, this anatomy and the biostatistics carries a hard questions. Okay. And mostly in the second paper, you will get more questions from the data interpretation, including the microbiological investigations and the reportings, and then pharmacology. These carries more marks. Okay.
So the only thing which I wanted to tell you is that it's all right that we have an idea that paper one contains this and paper two contains this, but there is a chance even in part two and part one that the questions might get mixed. So it doesn't make difference because we have to prepare everything. But often after part one, students they message after the paper one, they say, "Ma'am, we did get the microbiology." So it's all right if some things is shuffled, you should be ready for that. So it's okay. It is a computer-based exam, guys, and definitely it's in English. We have two exams, two papers, 100 single best answers each, and we should be knowing that MRCT Part 1 is the prerequisite to pass, of course, to take Part 2. And 50% of overall marks, of course, in Part 1, and then Part 2 is there. You need to understand that no negative marking is there, but you have the permissibility to flash or to flag the questions if at all you want to reconsider the answer. We would tell you about the practice. We will do multiple mock exams and you will realize that how it is going to be done. Yes, Safa, please.
Yeah. So as I already told, and the timings will be, 100 questions in the morning and 100 questions in the afternoon. But, students used to finish within 2 hours or both papers. This time in the last exam, June 30th exam, one girl from India, she messaged me by 11:30 a.m., ma'am, I completed exam. So this exam is a very, very, very easy exam. It is easy to, it is doable exam. So you need not worry much about the timings and all. You can finish it within time, not within time, before time as well.
So the time management we never have from the part one students that I was struggling. When you come to part two, yes, part two is like you're always struggling to be fast and do the extended match questions hurriedly. But in part one, generally we have to tell students to please calm down and still, sit till the end of the exam because they're just in so much hurry that they've revised the paper 2, 3 times. But still, we will explain to you that how to be fast. The Pearson Center, just a glimpse, guys. So you go to the Pearson Center, you have your identification check. They are non-medical. They conduct so many exams. So you just sit on your computer where you start your exam. You have your break. You come back and you restart your exam. I always suggest to take complete break because it definitely gives you energy for the next exam. But often students they just start in 10-15 minutes. So I generally am not in favor of that. I want you to calm down and be ready for the next exam with all the enthusiasm. Can I have Preeti here, please? Yes, Preeti, can you unmute yourself? Ladies and gentlemen, when it comes to
Hello.
anatomy, thank you very much. Thank you very much, Preeti. So
Hello.
Preeti is famous for her mnemonics. We can hear you, Preeti. Thank you. So Preeti is famous for her mnemonics. Preeti is famous for having wonderful session with lots of diagrams and lots of ideas about how to make anatomy retain.
So,
Yes, please, Preeti, go ahead, please. Preeti, are you there?
Dr. Preeti, are you there?
you know,
Yes, Preeti, are you there? All right, let me message
parts of the
Preeti.
thigh. Yes.
Yes, thank you very much. Preeti, now you're audible. Please go ahead. Thank you very much for joining. Yes, my dear.
Oh, I wasn't audible. Okay. Can you hear me now?
Please go ahead. Thank
Yes,
you.
yes, we can hear you.
Okay. So anatomy is very simple and mathematical. As long as you know it once, you won't forget it and you won't miss the score. So, we have lots and lots of mnemonics that we will be discussing. And anatomy is not only important for part one, it's important for part two. It's a sure shot 5 to 10 marks in your part two as well. So please make sure you do it properly. We'll be covering each and every topic that's required for obstetrics and gynecology. So we have the fetal skull, the pelvis, then we have the anterior abdominal wall, the viscera, the uterus, pelvic organs, and also the related structures in the abdomen, in the peritoneal cavity. So all of that is covered. Additionally, perineum, pelvic diaphragm, because these are anatomical aspects which we don't study in a regular MBBS course, but they're very important for MRCOG. Additionally, the blood supply, nerve supply, we have to memorize it and keep it on our fingertips right till the part two is over. And even in life, you need it. So once you do it with me, I don't think you forget because the students always remember it and they always keep on discussing. I see the discussions in the telegram also. And also the embryology part is very scoring, and we do it side by side so that, one after the other. So both the topics are covered together and the memory is created. So in the embryology section, we start with a little bit of genetics, then the development of the pelvic organs, the urinary tract, the gastrointestinal tract, the pharyngeal arches. All these are very important. Additionally, some questions do come about the germ cells, the origin of various structures. So we discuss everything with mnemonics so that the memory is created. And anatomy and embryology together is nearly 33% of your first paper. So if you know it, you just need 50 marks. You're surely going to pass. Even if you know these two very well, you're surely going to pass. It's like that, because you can't get less than 17 in the remaining part. So my subject is most important, right, ma'am?
Yeah,
Absolutely.
yeah.
And why I have chosen Preeti, because I know as a student, when Preeti used to be a student, she's always been very accurate with in terms of her memory, and she'll reinforce the thing so much. And the same thing she applies as a mentor as well. Preeti, students, they feel, I mean, even if I would be there, I would say that it is most volatile subject, because the things are there, of course, lots of branches, lots of things, relations of the anatomy. What do you think is the ideal way? Because now they're starting their journey. What is the ideal way? I feel that images, I feel the pictures, they still sit in my neurons. What do you,
Yeah.
as a mentor, because you have been teaching
So,
anatomy and embryo for so long, what is the best way to
yes.
do it and their
The
approach towards
pictures are definitely helpful. I've added a lot of pictures, lot of videos inside the presentation. So when you see it, it creates a memory. Additionally, we correlate the embryology and anatomy. We correlate the development of the organs and the lymphatic drainage, the blood supply, and we realize that as they're developing, like if something is developing from the foregut, the supply is always going to come from superior mesenteric. If it's developing from the hindgut, it's always going to come from inferior mesenteric. So sorry, foregut is celiac trunk. So in that way, if we remember correlating the development and the anatomy, we are never going to forget it. And then additionally, the mnemonics are there, and they create a very strong memory, because when we may know the anatomy, but when we see the question, they are asked in a confusing way. So if you have a trick to remember it, it's very helpful, so that when you see those four options, you remember it and you answer it precisely.
And one more question regarding embryo. They always ask that do they have to do vast embryo of everything, or there's specific things that have to be done? Because embryo, again, day-wise development is quite difficult to retain. So because 10 questions are coming up, so you have to put like specific focus on certain parts, right, Preeti?
Yeah, so we do our PowerPoints, the presentation, they cover most of the topics. And also pay attention when I'm discussing the extra topics, because generally the additional questions come from the extra discussion. For example, the first time it's come in the last exam, I think the bifurcation of the aorta is L4. Everyone has heard that question if you have done any discussion, but this time they asked it's the iliac crest, which structure is at the iliac crest. So they asked it in a different way. We had discussed it. So I'm sure our students got the score. So, these tiny things, and we had also mentioned with the iliac crest, the bifurcation, everything was given. So, I'm sure our students didn't have a trouble, but someone who's not seen it in that way, they may not remember, oh, L4 is iliac crest, L4 is bifurcation. So, each and every slide, do pay attention and also hear the discussion carefully, because those cover the extra questions also. All
Very
right.
well done. So what we do is we update ourselves according to the exam and according to the new criterias which are coming up, and to the confidence that the moment they take exam, they're already registered in part two. So that shows that how confident they are for their exam. Thank you very much. So we are here for microbiology. Do we have
Thank you,
a?
ma'am.
Thank you very much, Preeti. Take very good care of yourself. Stay in touch, my love. Thank you. All right. Yes, Safa.
Yeah. Yes, ma'am. So regarding microbiology, this is the paper. This subject will be there in the second paper. Okay. Many of the time, they will be asking about the clinical diagnosis, and sometimes picture questions will be there. They will give you the picture of the Neisseria, or sometimes the Trichomonas vaginalis, and they'll be asking. But whatever is important for the exam purpose, all these will be covered. So we divide into the bacteria, fungi, then parasitology, virology, and the interpretation of the syphilis, interpretation of the hepatitis is a very, very, very famous, I know, appreciated from the students aspect.
Absolutely. Microbiology, again, we make tables, we make pictures in a way. For example, if there are diseases, we would make comparisons so that you can, sort it out and remember in a better way. The idea about the sessions is that you're not studying alone. You're studying in a way that your memory is better. And when you see our efforts, our flashcards, you would be very happy that, yes, the image, the pictorial memory, that's all sitting in your neurons, and the memory definitely would be
Yeah.
better.
So along with microbiology, we have immunology. In immunology, you will have at least 5 to 7 questions. But most of all the questions, already mostly it is discussed in the session. They will be asking questions from the antigen antibody reactions, then hypersensitivity reactions, autoimmune diseases, types of immunity, sometimes vaccines. Recent time, vaccines questions were there. Okay. So everything will be covered in the live session. So mostly for these subjects, we are taking essential division guide as the reference. But the college is updating the guidelines. So we will be giving you the materials which is from the updated one. Like for example, CMV cytomegalovirus virus talk 2025 is there. From that talk, we will be teaching. Whereas this essential division guidebook was published in 2016. So all the updates will be available in the live session. So if you follow the live session, it is more than sufficient to crack the exam with more than 80%.
So here,
And it's
here
same
one.
for the
Yes, Safa, please
yes, ma'am.
complete. Yes, please complete your sentence. No worries. And the same for?
Yeah. So whatever we are discussing in the live session, this is mostly from the updates. So this will be helping you to crack the exam. There is no need for any other PDF, nothing to read more. Only listen to the live session and take notes, one-liner notes, and then practice more number of questions. This is the mantra for the passing part 1 exam.
So here is one thing which I would like to tell you, that students, they take up the revision guide and they start doing it cover to cover. I am an old mentor, did 2016 exam. So when I did 2016 MRCG Part 1, this we used to do it literally word to word, but things were very different at that time. It's been 10 years. Now things are very different. When you talk about immunology, now things are updated, but the book is the same. It has not been improved. But the questions now, the keys are new. Here you need to understand, so many students, they ask questions with that the revision guide says this, but why we are updating things? Because this specific part, immunology, applied clinical knowledge, the clinical and data interpretation, these are specific parts where the college has recommendations updated. So you have to follow what we have given in the study resources, you have to follow what we have given in the website, you have to follow the PowerPoints and the live session, and not those books which have been published 10 years back. Right? So please understand this and register this point, because here you guys lose score. If something is updated by RCOG, and you have to do that rather than the theory books that have been there and they had been published 10 years back. All right. I hope I'm clear on this, because here you may lose your 5 to 7 questions, which specifically comes from the updated part, please. Yes, Safa. Before Safa speaks something, biochemistry had
So
been my
about the biochemistry.
Safa, I would like to say something. Biochemistry had been my
Yes.
sword. I never liked biochemistry as a medical student always, because I was like Krebs cycle and all these things which had been in the biochemistry. I used to feel that no matter you do it 100 times and you forget it. The feedback which I get in the study group is that once you do it with these live session, you never forget, because the way you're going to see biochemistry with metabolism, with all these cycles, you would remember it like on your tips. And when I see students in part 2, they say the same, that we remember everything from part 1 from biochemistry. And the feedback had been truly amazing for the biochemistry. Yes, Safa, please. Why biochemistry has been so interesting and people
Yes,
start
ma'am.
loving biochemistry
Yeah,
afterwards.
ma'am, biochemistry is very, very vast subject. I understand. It's very difficult, but what is important for the exam? See, we have only 10 questions, and most of the time the questions will be repeating and the topics will be repeated. So after my session, students used to feel that yes, it's doable. I'll make sure that the mnemonics for the all the cycles and also vitamins. Vitamins are very important, and I used to take that from the nutrition books, and also about the cell signaling, this cell cycle. We will make sure that it is very easy busy for you all.
Thank you so much. They're looking forward for that. All these are very important, guys. So making a good memory for each section. My aim, and when I do meeting with my mentors, that every single section, 10 questions, 5 questions, 7 questions, we have to fight for these questions. I don't want all of you to pass only. I want each one of you to score more than 90%. So this brings this confidence to part two, aiming for the gold medal. Let me tell you guys that MRCT part one, part two, part three all have to be in first go. So let's aim for the highest score and not only passing this exam. Pharmacology,
Yes.
please.
Yeah, next subject, I'm going to take this pharmacology. So in this we have general pharmacology. Then what are the drugs used in the in obstetrics, like tocolytics, antihypertensives, and what are the drugs in the gynecology, like drugs for the heavy menstrual bleeding, drugs for ovulation induction, then contraception, very important. So in all this, we need to know about the which is the drug of choice, and then mechanism of action and the side effects. So mostly there are updates. Always pharmacology is the one always daily getting updates. So we can't follow the book Essential Revision Guide for Pharmacology. So we will be providing you the updated ones from the talk articles. Okay.
So we always have talk articles updated every 3 to 4 months. We get a publication, guys, and generally part one students, they don't know about this and they don't need because it's part two curriculum. But what we do is we make it easy. For example, new tables they come up from the breastfeeding talk article is such an important table. They don't leave that literally till part three. So when you do pharmacology, I would suggest that please have an escape from the revision guide and please do that from our session, from our website, from our flashcards, because that would be updated
Yeah.
one. Till April 2026, whatever talks have been released, whatever medications they have updated, the recommendations they have given, we are going to add that in your session. And please do that with an updated pattern. All right. Thank you very much. Yes, please.
So in pathology, you will have a general pathology asking about the inflammation and the necrosis, and then they will be asking about what are the cells involved. And then we have a benign gynecological pathology, and we have a malignant gynecological pathology, which will be having both, which will be having more number of questions from the pathology, like 15 to 20.
It is more than others, so it is a major subject, guys. Yeah, so don't miss that out, please. All right, so physiology. Your mentor Akansha is just in traveling. She was just traveling from UK, guys. She's going to take physiology for you. 10 to 15 questions would be there from this. We are going to cover male reproductive system, the female reproductive system, the physiological changes in pregnancy, the fetal physiology, and all these things would be made very easy. You will soon meet your mentor. Just because of the traveling, she couldn't be here. Endocrinology, again, you have to continue within endocrinology, and I think we have Urva here. Urva, can you unmute yourself, please? Your students would like to meet you.
Hello, ma'am.
Hello. Hi, how are you doing today, my dear?
Great, ma'am.
Thank
So,
you.
endocrinology is like very clinical kind of a subject, because whatever we do it now, like from part one, it's going to be remaining with you till part three. So that starts all from what the hormones are released from the pituitary to the adrenals, the corticosteroids, and I feel the sex steroid pathway and the adrenocorticoid pathway. All these are a little bit difficult for the students, and we'll be dealing it, and we'll be understanding how to remember those tables in a easier way. As well as the GDM, thyroid is going to be there, as well as amenorrhea. So how to understand about primary amenorrhea, secondary amenorrhea, how to deal with that, and all the menopausal symptoms, everything will be covered in endocrinology for them. And for genetics, I feel everybody's scared about how to see the how to do the pedigree, because that's the most dreaded thing, and I feel nobody's able to understand that. But with practice and what we do in the class, everybody's able to understand it very well, especially the autosomal recessive, how to find out how it is autosomal dominant, X-linked recessive, and X-linked dominant. So that will be cleared in a very easier way, how to remember all the disorders. So these disorders which we read now, they are important, I feel, till part 3, because there are questions, Alport syndrome and everything. So we need to understand that in detail and clear our basics now itself, and understand how all the disorders are there, the NIPTs, about dual markers, and all the testings which we do, the monosomies, trisomies, how these things happen. To understand it and also imply it in our clinical practice is very important, ma'am, I feel.
Absolutely. Urwa, what is the right way to approach for the genetics and what is the right way to approach for the endocrinology? Because endo, I think, is volatile and they can link it up as per the questions. Of course, 10 questions, and I say every single question is important. Genetics
Yes.
for me is mathematical because I'm taking the part in MRCD part 2 as well. It won't leave you. If now you'll make your genetics stronger, literally that would help you till your part 3. So that's such an important. What should be their approach towards these two subjects, Urwa?
For endocrinology, I feel they should be clear with the basics first. Like, what's the reason, what are the tables which we give them, how to diagnose what kind of amenorrhea it is, what tests we are going to do for the same. So that's really very important. And, like from diabetes, which you're going to do now, it's going to be there till the end. The endocrinology, all from pancreas and everything is going to remain. So, ma'am, I feel if they know the basics from the start, as in why the disorder is happening, what's happening in the prolactin, what's happening in the pancreas, if they understand this basic concept, what is about the glucagon, what is about insulin, and all these basic things, then I feel it's, they can just keep it with them throughout, it will be implied at all the places. And also in genetics, ma'am, yes, it's mathematical. So when we make those tables and when we imply those tables, like, X, what is XD, what is XX, what are formulas, what are the one liners we give them, so those one-liners will help them solve all kinds of questions.
Absolutely. The flashcards of genetics are famous from our side and they always are asked for. So if you do those flashcards of one-liners of autosomal dominant, recessive X-linked dominant, that would really help you guys. So we need repeated, of course, revisions for that, but you will be okay after that, knowing and understanding the concept. Thank you
Yes.
very much, Urva. Stay blessed,
Thank you,
my
ma'am.
dear. Be in touch. Thank you
Thank
very
you.
much. All right, so we've got biophysics. Sarika, I'm taking your question just in a bit after completing the curriculum, sweetheart, okay? Biophysics is 5 to 10 questions. We do get some questions from the X-ray, computed tomography, magnetic resonance imaging, the ultrasonography, ionizing and non-ionizing, electrocautery, the cardiotocography, we also CTG, we also do in this. So biophysics is less question, but more of the physics is there, but we'll make it very easy into the session, so you would love it. Once you complete with all the mentors, you meet me as a humble lead, the clinical and data interpretation I'm taking myself. You have different questions with the recommendations of Green Top guideline. We get the fetal infections, different scenarios they come up and you have to reach to the diagnosis. The CTGs come up in terms of the decelerations. You need to find out the reason. Is it a suspicious? Is it a pathological? Do we have the new criteria of white, amber, and red? We need to do the updated, nice cardiotocography with the fetal heart rate values, which is updated last year. We need to know the laboratory values of certain investigations like that of subfertility, World Health Organization, semen analysis, the ovulation disorders. With regards to the fetal infections like chickenpox, as Safa mentioned a little while earlier, cytomegalovirus, parvovirus, they love asking the fetal infections, they love asking about the maternal medicine from there. Acid-base analysis, common pathology overlapping with data interpretation as well. We do the GBS, herpes, all those where they give you scenario-based questions, the clinical data. The challenge which we face, which I see in Part 1 students, is that most of the Part 1 students, they might not have some clinical experience. I mean, they're very new in the obstetrics and gynecology, and I do appreciate that they're starting their journey pretty earlier. But at the same time, because they've not seen the patients, they don't have the experience of evaluating or managing the CTGs with the patients in the labor suite. So I do understand that it's tough. But with this session, you guys would understand at least what's needed as per exam. What is the sufficient data that will make you score higher in MRCOG1? And so leave it to us and we will groom you, we will teach you what's needed despite less of the clinical experience. You will manage this part of your MRCG part one pretty well. All right. Thank you very much. Coming to Sarika's question, because we have regarding the passport. So regarding the passport, you have to write an email to college to the exam query, Sarika. And you have to tell them that this is my passport name and these are the degrees maiden name. College would write an email back to you that we have registered that. That email is very important. When you go to the PSN center, they would actually find it out and discuss with you there. And you will show to them that this has been communicated to college. And that email is going to be a proof that, yes, you are the same individual that is on the degrees and with the passport as well. Sarika, right?
Okay,
And you
Okay, ma'am.
yes.
Okay. Thank you so much. Thank you.
Thank you. Most welcome, my dear. Safa, are you there for biostatistics?
Yes, ma'am. Yeah.
Please.
Okay, ma'am. So this is a very, very important subject as far as, part one is concerned.
Yes, please.
As far as part one is concerned, biostatistics is very important because, if you attempt this questions and if it gets corrected, you will get high percentage of marks. Okay, comparing to your colleague who is not attending these questions. Okay, so and this is in this we will take in a session like 3 or 4 splitted sessions. We will be giving more important for the what are the important in aspects of part one exams. So screening test, variables, and then test of significant study designs. All this will be explained in separate sessions with the examples. And so after the session, most of you will be able to crack all these questions easily.
Perfect.
And
Yeah.
and I know that this is a very, very, everyone is scared about the biostatistics. But we will be make sure that it will be explained in a way it is very easy busy.
Thank you very much. You'll start loving statistics. And when you come to me again in part two, you've got a very strong basis of biostatistics. So this is the famous revision notes for MRCOG part one. You don't have to worry about these books. Everything is in your study group. Everything is available there. These are certain practice books because one part of preparation, friends, is remembering and learning the theory. And second part is knowing the books. If you ask me as a student, I know the lines of the books. I know the question number, which I used to make wrong. I have a page memory still till date. When I'm teaching in part two, I'm telling them that page number 40 of Sir Janesh Gupta's book is saying this. So please go to that reference. When I'm teaching, I tell them angiocyza. If you go to that book, page number 84. Reason for that is that we have rehearsed so many times, and I expect the same from my students always, that please practice more. If you feel that you have learned the theory, you are ready. So whenever I get this question, I always say, yes, you're ready, but 50%. 50% is preparation of the theory and 50% is always practicing. The more you practice, the more you reinforce, the more you make mistakes, you are ready, getting ready for exam every day. So all these books are available. We do that in the group, study group as well. You practice with the moderator. Kusuma, are you there? Hello, hi Kusuma, are you there, my dear? So when you practice for the with the moderator, you make mistakes, and I always say it's okay. It's absolutely okay to make mistakes because every single mistake which you're making is making you go closer to the correct answers. Day by day, step by step, you're feeling better. So please don't worry about that. We are not able to solve the questions because when you're solving questions after the session, you make your memory better. You may make an answer incorrect if you have made it correct in the study group. But I always say, if you have made a mistake in the study group, that thing always stays with you forever. And you can recall it even years and years they pass by. All right. I don't want any student of mine. When you join RFA, it's a family. When you join RFA, it's a connectivity. RFA, when we talk about the study group, it is a very strong association to an extent that you guys would feel, and you'll start missing the study group. The students in part two, we've already reached 600 plus. We have not started to full throttle yet, but it's just that they feel like a family. They're so connected to each other. Until part three, they feel that we have that association understanding, and they help each other globally. Alumni is there. I want the same set pattern. I want that when somebody asks something in the study group, it's not that you're waiting for the moderator. You are helping, like this is your own family, and we all have to support each other in all the ups and downs. We need to understand the mindset has to be very clear. We need to be away from the examination stress because of our practice. We need to understand the examination strategy, and we need to aim passing this exam in one go, not one, not two, not three. I want the entire batch to be successful without even a single student not being able to make this exam. This should be our aim. Together as a family, step by step, we would be having meetings. I will be supervising the mentors. I will be supervising the data, the updated material. The moderator discussion has already been started. What I want is results from your side so that we just clear this and move ahead for the part two, please. Your willpower is needed. A perfect time management is needed. A focused study schedule we have given you. We want you to follow that in a very targeted approach. Samsung, I'm sorry, I don't know your name. If you could write it down, it will be easy for me
Ma'am,
to.
so regarding our groups, ma'am, we have all the materials are there in the channel. So that is a study resources. So in that study resources, it is organized in subject wise. You have all the previous books and also the recalls and also the book questions, SBA books questions. It is arranged. Okay, there is no need to buy anything, any books, nothing you need to buy. Okay, if you want, you can take a hard copy from that PDF.
So all of you, please, thank you for why I've renamed you, my dearest. Thank you. So all of you, please, you don't have to buy any book, please. Everything is being practiced in the study group. Once you have joined, you just have to follow the study group. And all the books, everything, all the resource material, all the past papers are so dedicatedly distributed into the questions separately that you just have to learn them and just follow the sessions as Preeti, Orva, would be doing, Akansha, Safa would be doing, and your moderator would be discussing every day, right? So this is needed, and you would be feeling the change gradually with each session. I want your feedback after the session. I really want that things are getting better. You're gaining the confidence with us. We want to do word by word revision guide, but we do want that skip those things which are not updated. How would you come to know? You would come to know from the session. You have to make one liner, right? And you have to practice important exam questions multiple times with us, that when you come back from exam, like these students, we are still waiting for the result, guys, and all of them are already with me in part two. Reason for that is that this gives you a confidence that new questions are coming up, but still they're doable. So confusion questions, I expect all of you to please make a separate folder. Till the end, there will be like few questions, 20, 30 questions, but it will be out of this world. It's absolutely okay. As a student, I still remember that I used to give less importance to those who are always confusing and make a very good exclusion criteria in the exam, and you manage those questions, right? So 15 live sessions, we are covering all subjects for you. Statistics might be more sessions depending upon your understanding, because sometimes it gets so dry and so longer that we do decide that we have to split that sessions for your better understanding. In website, all the question pools of the world are available. You have to practice those questions. Subject wise, we have given them so that you do practice your mock exams there. You complete one subject and you will start the mock exam so that you analyze that where do you stand on that subject, and then you move to the next. When you move to the next subject, I want you to give 1 hour to the previous subject so the memory is better and that stays with you there, right? We had been having so many.
Ma'am, here we need to announce about the daily discussion timings. So in the paid group, yes, ma'am. In the paid group, we have a daily discussion in the by 1 p.m. GMT. That is the same time of today we started this live session. And the live session will be on every Sunday. That is also timing is same 1 p.m. GMT. And in our open free group, we have a daily random records discussion that will be around 4 p.m. GMT.
All right. Did you guys understand? Please note it down so that you don't miss it out. If somebody tends to miss the live discussion, it's okay. What I say is that before sleeping, please scroll the question so next day you're ready and you don't have a backlog. Is that okay? Ghazala, Farwa, everybody, please. Atik, are you there? You guys are noting down these points, okay? Don't miss that out, please. If you talk about the students, they had been having so much of a strength in their part one subjects that I feel that after the part one, they're having a new approach towards obstetrics and gynecology, and that is further reinforced when you reach to part two with us. And finally, it's just the communication exam, MRCOG part three. May I ask a question in the chat box? If somebody wants to unmute, you're more than welcome. But if somebody wants to write, even then, it's okay. Why do you want to take this step? All of you, I want the reasons. What is in your mind? Why each one of you, Sarika, Faizun, all of you, Dagbani, Atik, why you guys have chosen to take MRCOT Part 1? Yes, please. Why do you guys want to do MRCOG at first place? What is the reason that you have started this journey? I'm waiting if you want to unmute yourself. I'm happy to listen to your voices. If you want to write and type, what made you decide that you want to take MRCOG? What is the reason behind that? What is that passion? What is that trigger? Yes. Anybody wants to unmute or you want to write? It's my dream to get this degree, Sarika. Maha, I want to learn more. All right. Okay. And come on, guys. I just want that why you're choosing this. Do you have some aim behind? Definitely when you're going through so much of a challenge, what would be? Nagamani says can improve our standards, the patient care. And it's your dream to acquire that degree. iPhone, I'm sorry, don't know your name. And Zoom user says, I want to upgrade myself. iPhone says, it's an international. I want to have an international degree and not staying local. It's my dream to work in UK. Faizun, all right. Okay.
Hello,
Anybody
madam.
else? Yes, Shahnila, why do you want to take MRCOG?
Madam, my dream is I want to make practice in UK. That's
Okay.
why I want to shift over here.
All right. So that's the reason that you're choosing this pathway. All right. Thank
Yes.
you very much for letting me know. I was expecting these answers. Ghazala Mughal says it's international exam, getting good job and increasing my knowledge. 100% Ghazala. I was expecting these answers. Now I have a question. Part one, when you will do, there will be a time that we will be stressed out. Sometimes kids get sick. Sometimes the family members, parents have some commitments. Sometimes the hospital is not being very easy and cooperative with you. Sometimes we have issues with the in-laws. Sometimes husband is not supporting. Sometimes wives are not supporting. Sometimes siblings are being uneasy. Sometimes you cry. Sometimes you feel so low. If not in part one, this might happen in part two. You might get a failure somewhere in between. I don't expect that in part one though, but part two and part three, you might get a failure. So today, Alicia, thank you very much. This is your dream. I understand, I respect that, and you want to practice in UK. So today, you guys are starting this. Tomorrow, when I will be talking to you guys, each one of you, Atik gives me international recognition. I would like to practice in Ireland or UK. Perfect. That's understandable, my dear. Now, tomorrow, when you guys would face some difficulty, which I do foresee because it's a long journey, it has got 3 parts. Would you guys be giving up? Today, if you're taking this journey as a passion, you face some hurdle because it's life, right? Things are never always smooth. Would you guys be giving up in a way that I want, it's okay now, let's give up. Why am I doing that? Would you guys be reconsidering your passion or your dream? How many of you are strong today? And how many of you are going to think it's all right, we do have a second option as well? How many of you feel today we are ready to face the hurdles? How many of you are ready to face the challenges? That might be lack of support. You might stand alone. Nobody in the hospital is supporting, nobody at the workplace is supporting, nobody at house is supporting. Thank you very much. I'm so proud of you. Sudanis are always in heart. Thank you very much. I'm here to support all of you. Thank you. So Alicia says, I'm ready to face the challenges. Atik says, not at all. I'm not going to give up. What about others? Sarika says, this is my first and last attempt, so I won't give up and I need to chase my dream at any cost. That's like my girl. I loved this enthusiasm, Sarika, and I loved the choice of words. Too strong on that journey, Allah would help. Definitely, inshallah, Khasala. Definitely. I want to tell all of you that be ready for that. You're taking the first step. The first step, I'm hoping, as always, the chances are 100% success would be there because it's an entrance exam and definitely college wants you to, pursue the career as a Mrcog. Ameen sum ameen faizun. Nagamani says, I won't give up. Very well done. Today, what you're deciding, please think today. But if you have decided today, there's no turning back. I'm always of the view that in life, take a decision after thinking 100 times. But if you have taken that decision, then there's no turning back because people would want you to be weak. People might not stand besides you. But if you have a passion, you don't need anybody. I will give you the ways. If you go to Instagram, you watch my videos, you will find always motivation. Why? Because at the end of the day, it's only you who is going to make this career successful. I have students testimonial who have done part 1, part 2, part 3 just in 9 months to 12 months, all in one go, starting back to back. But there are students who have struggled as well. But when they have failed, they have again made a comeback. They have again taking it as a challenge. They've not accepted that failure. Whatever would come your way, you promise me today that till you get that last email of Mrcog part 3 being passed, you will take it as a challenge. You, yourself, and only you, because it's going to be your success. People, they don't matter what they talk, what they decide they are with you today, they might not be with you tomorrow. It's absolutely okay. You have to focus on yourself and make your tomorrow better than your yesterday and your today. If you promise me this today, you would see how that thrill would come up, how that passion would come up. And this is what I believe. When I decided that I'm doing Mrcog, back to back after that MRC by Mrcog, nothing was a hurdle despite so many challenges, despite so many difficulties. We face difficulties as a mother, we face difficulty as wives, we face difficulties as doctors, as hospital routine, everything. But when one passion you have decided, I want that everybody would be giving motivation to each other. I want love and support from each other. It's all right. The time will pass by, but you have to clear this exam. And that day you will tell me, remind yourself of today, that today you have taken that decision. You all would be successful if you don't miss out that energy deep down inside. Am I clear? This is my minimum requirement from each and every mentee out there. All right. Thank you very much for this. The live session schedule, 19th of 7th month, 2026. You're going to get the anatomy 1 and then anatomy 2, and then we have the embryology, please. The discussion is going to be according to this: anatomy, embryology, biochemistry, physiology, all is in front of you. We are going to have the live sessions the same time, 1 p.m. GMT, everybody. All right, Rahab? 1 p.m. GMT would be the live session. After the live session, the recording gets uploaded. So if you're not able to attend the live session, I do suggest always attending the live session. But if you're not attending the live session, you guys can have the recording uploaded. Definitely, you can revise it as many times as you want. The ones who have joined in, who are not here, who are here actually from the open group, you may join today. That link is available. Everything would be going on live, the Telegram discussions. We would do in a way, in a quiz-wise manner so that you don't miss it out. Please, a humble request from my side that when you join the course, open this welcome pack and see that welcome pack, because your 99% of queries would get solved once you do the welcome pack, and the team has really put in too much of an effort on that. Okay, everybody is gonna open up that welcome pack. You're going to see this welcome pack. This welcome pack contains the all frequently asked questions. You will have 28 pages of this welcome pack until the 28th page. Please do that before you sleep today, because that's going to help you for many questions that's with you. So Sarika says, if all participants can discuss with each other too, also in the paid group, or only mentor. Definitely, yes. You have the discussion with the moderator. If you want to decide your time, do that in the group. We are happy for this. Atik, take the lead. Sarika, take the lead. Pick up the topic for the day and start discussing whosoever wants to join. But there should not be a separate group. It has to be the study group. Why? In the premium group. Why? So that we can see that what you guys are doing. You have to be under supervision. I don't want that you are studying haywire, right or left, and you're right in the right direction. Okay? So take the lead. Sarika, if you want, Atik, you want, I want you guys to go ahead with the mutual discussion, discuss with the moderator, and go ahead. Ghazala, I've shown you the live session schedule. It's already there, pinned in the study group as well. And it is there on your website as well. All right? Okay? Everybody clear about this? Any questions, any comments, any feedback, anything from our side, any improvement? Never hesitate to drop in a message directly, whatever time it is. It's morning, it's afternoon, it's night. I'm always available. Once I'm taking the live session for part 2, part 3, I am busy for RCPI or the Epcog. I want you guys to just wait for a few hours, 3 to 4 hours. After that, definitely I get back to my WhatsApp and Instagram, and I reply to all the queries there. If anything you feel that needs improvement, if anything for which is you feel that as a student that should be added, I'm right here to improve on the standards. I'm right here to improve and work together. Every single mentor is going to work day and night, and you will see the change after the live session. But still, if you have some individual thing to discuss, if you have some individual circumstances to take guidance from, we are always there to hold your hands, not only in part 1. This is just the first step, part 2, part 3. And once you clear your part 3, you will be remembering this day when you started this journey with RFA. Thank you very much for being with us today. All those who are listening to the recording, if anything is not understandable, please stay connected, and we are here, right here to guide. Anything which you want to ask regarding the documents, regarding the prerequisites, regarding the eligibility, regarding the session study curriculum, schedule, if anything is not clear, we are happy to repeat, please. And we are open to the questions, please. Yes, anything which you want me to repeat, anything which is not clear. You all are clear about the expression of interest, for the eligibility, about the curriculum, about the session, about the mentors, about the study group. Anything is remaining or anything you want me to repeat, please let me know. All right, so we'll be starting anatomy. So what will happen if I do eligibility before the expression of interest? Doctor, what happens if I do eligibility before the expression of interest? Eligibility, you can send, my dear. Expression of interest is opened on the date. So we can do expression of interest when it opens, right? I mean, there's a specific date for it to be opened, right? And then we click on
No,
that.
actually, ma'am, most of the time students will be sending the expression of interest once the eligibility approval come. But college says it's not like that. You can send both the time. Both
Got
at
it.
one time. Okay.
Done? So basically when the link
Yeah.
opens. Okay, when open?
Yes, now it is open. All of you can send your eligibility. Now
do
it's
them a favor. Go to the website and copy the link and put it in the group so that they can go directly from there. Okay, Safa is just going to put that in the premium group now. All right?
yeah, okay.
She's doing now. All of you, please go to the premium group and see.
Once you send your expression of interest, Dr. Faizan, you will get a message that thank you. It says that your expression of interest is accepted. That's it.
All right. Sana says, what are the prerequisites? Sana, I think you joined late. The first 20 minutes of discussion was the prerequisites, my dear. The recording would be uploaded and it will be on YouTube as well. So we'll just share that. And you can see the first 20 minutes, all the prerequisites were shared.
Yeah, after the eligibility, there is no mail. you may get an automated reply, but you have to wait till the last date of application. After that only they will send the approval. No, not required. Once the eligibility done, it is for all ever. Okay. So there is no need to repeat the eligibility, but you have to send the expression of interest for every exam.
Most welcome, Atik. Any other
Thank
question?
you, dear. Thank you.
Any other question? Can we have a discount coupon, please? So in the group, it is there. Maha, you can message me direct as well. The discount, okay? Right? Okay, thank you very much. Any other question? Any other
Yeah, do
question?
you have any questions?
All right. Thank you very much, everybody. So we are here today taking this oath. I want one thing from all of you. Take one piece of paper, may that be a stick-on, and I want all of you to write your aim, to write your passion. On that stick-on that today I'm taking this oath that I am taking Mrcog as my dream, and I'm going to complete all these steps with all the passion, despite all the ups and downs. We will face it together, hands in hands, getting the support from the mentor, getting the support from the RFA family, but we would not step back. Please paste it on your dressing table mirror and send me a picture on my WhatsApp or on my Instagram with the reason why you are doing. And every morning when you wake up, please see that dream so that you get motivated. The day when you will be on your convocation, you're allowed to take it off from your dressing table mirror. Why I'm saying dressing table mirror? I assume that that's one mirror which you don't skip seeing every day. Am I right? Thank you very much. There's no WhatsApp group, Sarika. We just have the Telegram group, reason being old chats, because people, they keep on joining so they can see the old chat. In WhatsApp, Sarika, the problem which we face is the students can't see the older chat. So we do make the Telegram because of that, because of the administrative reasons, my dear. Okay, all right. So I will be waiting for that motivation, and let's start up with full enthusiasm. Despite whatever comes our way, we would be making it a success. We are not aiming to pass this exam, guys. We are aiming to score highest in MRCOT Part 1 and to come to Part 2 with full confidence that we are capable. We have our own record of 98% in MRCOG 1, and you guys would be the one to break that record. And this batch of Jan 27 would prove to be the best batch of RFA tutors. Thank you so much. Where we do the daily discussion in the group, Kali, you do that, my dear, in the premium group. And daily it has been started. All right? In the premium group. So we are starting up with anatomy, guys. All right? Yes? Any other question? Any other question? Done? Okay. Thank you very much for being here today. Thank you very much to all my mentors. Thank you very much to the backend team for always helping us with the coordination. Thank you very much, everybody. We would like to call it a day with this hope, with this enthusiasm that all these students which you see on the screen are from London mock exam. RFA tutors, I would like you to reach to MRCOT Part 3 as early as possible, and let's make this first step with the highest score success. We are proud of your efforts. I love you guys. Take very good care of yourself, and we are praying for you. Let's take this first step with full enthusiasm, and may the success be with you guys. 15 seconds of prayers of togetherness. So I hope and I pray that every single step from this point onwards, may the blessings be with you guys. Whatever faith we have all over the world, I believe that togetherness, that does matter. I believe that the faith which we have in making it a dream come true, that would actually be the striving part for you to reach to the success and the finish line. 15 seconds of prayers, please, and we will be back to end up the session. Thank you. Amin, Suma, Amin, thank you so much for being here today. Thank you so much. If any questions, any queries, if anything you want to discuss, we are right here with all these prayers. Thank you very much. Take very good care of yourself. RFA stands beside you. Take very good care. See you guys in the study group with all the motivation, with all the love, with all the blessings, with all the togetherness. Thank you. Thank you, Rehab. Thank you very much, Nagamani. Thank you very much, Kali. Thank you very much, Ati, Kazala, Mona, Sarika, Manishi. Thank you, Maha. And all those who are not here for the live session. When you listen to the recording and if anything is not clear, please let us know. Thank you very much. Bye-bye, everybody. Take good care. See you guys in the study group. Thank you. Bye-bye from our side. Thank you.